Subacute thyroiditis is another type of thyroiditis. Now, as I told you that it is just like the acute thyroiditis, but the difference is here is that it is almost somewhat less severe from the acute thyroiditis. Acute thyroiditis, as we discussed, that it causes severe symptom in the patient like severe pain, swelling of the neck, and fever. The patient suffer from all of these things. Where in case of subacute thyroiditis, there are less severe symptoms that remain for a short duration of the time. Now, subacute thyroiditis is also called as the granulomatous thyroiditis. Now, that means there is a granuloma formation or the granulomatous reactions takes place in this type of inflammation, due to which it is known as the granulomatous inflammation. Basically, the cause behind this type of thyroiditis, as I told you, in the case of the acute thyroiditis, there may be any systemic infection that then spread to the thyroiditis. In case of subacute thyroiditis, mostly it is the infection of the larynx or pharynx or the region of the neck. There is the infection of these areas that then spread to or affect the thyroid gland as well and cause the disease. Mostly here the causative agents are those that affect the respiratory tract and cause the respiratory tract infections. Like there can be the bacteria, there can be the viruses, the respiratory syncytial viruses can be the reason. All of these can lead to the infection of the thyroid gland as well. So we can link the subacute thyroiditis with the granuloma formation or the granulomatous reaction, and also link it to the respiratory tract infection as well. Now, the patient who is suffering from the subacute thyroiditis, he or she may present with a pain in the anterior neck. Now, as the neck will be a bit swollen and the patient will experience the pain, then there will be the fever. The patient may show malaise, and the fever are the two important features. Then fatigue and the pain radiating to jaw. Now, this is another feature that distinguishes the subacute thyroiditis from other type of the thyroiditis, that the pain of subacute thyroiditis can then radiate to jaw. Now, let me tell you here that the virus that is causing the mumps in the patient, it can also lead to the subacute thyroiditis. So that is the reason the patient who is suffering from the mumps also may feel the pain in the hair in the neck region and can suffer from the symptoms of the thyroiditis. So maybe the pain that is radiating to the jaw, maybe the reason behind this is the virus that is causing the mumps. Now, if you look at the morphology of the subacute thyroiditis, this will tell you that why we are calling this type of the thyroiditis also the granulomatous thyroiditis. If you look at this diagram, you can clearly see that the colloid will disperse and it will come out of the cells of the thyroid gland, and here it will form the granulomas, or there will be the granulomatous reactions that will take place, and there will be the accumulation of the different material that will appear like this in the histological slide. That is the reason we are calling the subacute thyroiditis as the granulomatous thyroiditis. And apart from this granulomas that you can see here in the histological slide, you can also appreciate the inflammatory filtrate, and you can also appreciate the atrophy of the follicular cells. There can be some other bodies that can be present there. External bodies can be seen in the cells, and also you can find the bacteria and infiltration of the B cells, lymphocyte. Lymphocytes are the most prominent cells that can be seen in large number in case of the subacute thyroiditis. So these are some prominent features that can be seen in the patient of the subacute thyroiditis. You can distinguish the patient from other type of the thyroiditis because he is suffering from the neck pain that is radiating to the jaw side, and also this onset is sudden but the symptoms are less severe, and in the histological slide or histological examination there will be the appearance of the granulomas that will confirm that the patient is suffering from the subacute thyroiditis. And last but not the least, the patient may be suffering from, or the patient suffers some days before with its respiratory tract infection that can lead to the subacute thyroiditis.